All right. Good morning. This is April 14th, hard to believe. And we are here with the Senate Health and Welfare Committee meeting, going through some bills. And just for folks who are out on YouTube, we're a little bit late because times are very busy right now in the State House, and we're trying to complete all our work, and many of our members have work in other committees to attend to. So we're doing what we can, and we hope that we can accomplish the goals we have set forth this morning on the bills that are listed on our agenda. So Katie McClinn is here, and I think what we'll do is start with H711, and then we'll go on, because I know Senator Hardy was unable to get in here right now. She very much wants to be a part of the discussion on 720. So why don't we go to 711?
Okay. Good morning, Katie McClinn, Office of Legislative Counsel. You have an amendment to H711. Just to refresh your memory, this is the opioid settlement bill. There are different settlements coming into the state, and this bill sort of creates the mechanism for receiving that money, making decisions on how it's spended, and the process for expending the money. So there is an amendment that's posted on your committee page. It's a small amendment, and it came from Josh Diamond of the AG's office. And the idea behind it is that since the bill passed in the House, there's been funding, the Purdue and Sackler funding is the process is underway to bring those funds to the state. And the thinking is that this bill could be the mechanism for appropriating those funds as well. In the bill that came over from the House, there was language about how the special fund shall consist of all abatement account fund monies dispersed by the National Settlement Fund Administrator. And so this language has been expanded to incorporate other monies that might be dispersed. So the Opioid Abatement Special Fund shall consist of all abatement account fund monies dispersed by the National Settlement Fund Administrator to the Department, the National Opioid Abatement Trust, the Supplemental Opioid Abatement Fund, or any other supplemental funds that must be utilized exclusively for opioid prevention, intervention, treatment, recovery, and harm reduction.
Okay. So this came from the AG's office, and the settlement, they were actually responsible for negotiating the settlement agreements in the first. Okay. Committee, would you like to go look at the bill one more time, and then we put this into context? Katie, can we do that?
Yes.
Okay.
Pull up the tab. Okay.
As passed by the House.
As passed by the House, yes. So if you remember, there's sort of some logistical kind of maneuvering at the beginning of the bill. There's an existing chapter on the treatment of opioid addiction. We're not changing anything in that chapter, except we're making it a subchapter, and we're renaming the chapter Opioid Use Disorder. And then we're creating a new subchapter on opioid settlement. So we're just sort of broadening the title to incorporate more topics underneath it. So in the first section of the subchapter, it is the purpose of this subchapter to comply with any opioid litigation settlements to which the state or municipalities within the state are a party regarding the management and expenditure of monies received by the state. While an opioid litigation settlement may designate a portion of the monies for local or state use, this subchapter applies only to monies from abatement account funds. So this is sort of saying that we know that there are multiple sort of buckets. There's the state bucket, the local bucket, and the abatement. And we're only, this bill only touches on the abatement funds. This doesn't talk about how the local or state funds money is appropriated. And then we have the advisory committee. Subsection A creates the committee. Subsection B is the membership of the committee. And if you remember, the settlement requires that there has to be a one-to-one split with regard to state and local appointments on the committee. And one of the settlements requires that the chair be a non-voting member. So we have that the membership is the Commissioner of Health or designee, Chief Prevention Officer, a member of the House, a member of the Senate, a primary care prescriber with experience providing MAT within Blueprint hub and spoke model, and that this person provides a statewide perspective on the provision of MAT services. And Subdivision F, a provider with academic research credentials appointed by UVM to provide a statewide perspective on academic research relating to opioid use disorder. 2 individuals with lived experience of opioid use disorder, at least one of whom is in recovery, one appointed by Howard Center Safe Recovery and one appointed by the Vermont Association of Mental Health and Addiction Recovery to provide a statewide perspective on the experience of living with opioid use disorder. Then we have an assistant judge. That assistant judge is appointed by the Vermont Association of County Judges and is representing a local perspective. And then 7 individuals employed by or an agent of different cities and towns. And those are appointed by the Vermont League of Cities and Towns. Subdivision 2 talks about how members are appointed and how long they should hold offices for and how vacancies should be filled. Subdivision 2, B at the top of page 4, talks about how a member is to be removed. The removal of members, having a process for that is required by the settlement. And then in subsection C, we have the powers and duties of the committee. They have to demonstrate broad ongoing consultation with individuals living with opioid use disorder about their direct experience with related systems, including MAT, residential treatment, recovery services, harm reduction services, overdose, supervision by DOC, and involvement with the Family Services Division. And to that end, the committee is to demonstrate consultation with individuals with direct lived experience of opioid use disorder, frontline support professionals, the Substance Misuse Advisory Council, and other stakeholders to identify spending priorities related to opioid use disorder prevention, intervention, treatment, and recovery services, and harm reduction strategies.
Katie, was there any discussion in House Human Services about, and I may be missing it here, I know that the Chief Prevention Officer is on this, but to include input from the Prevention Council?
The only input from like an organized group is the Substance Misuse Advisory Council.
So that's not the big prevention council that we currently have in DOH. So I'm thinking it might be a good idea to add that. Yeah.
Okay.
And then other stakeholders.
Okay.
Yeah.
Is this the group that Monica was talking about yesterday?
Yes, not the coalition, the prevention council that's currently in the Department of Health.
Okay. I'll have to find where they are in statute.
Yeah.
Sorry, Katie. Okay.
We're on 711. We went through the proposed amendments, and now we're looking at the bill just to remember what's here.
Okay, you're all awesome. Thank you.
And we are on page 4.
And now I'm down at the bottom, at the top of page 5, bottom of page
Okay.
4. So the advisory committee shall consider the impact of the opioid crisis on communities throughout Vermont, including communities' abatement needs and proposals for abatement strategies and responses. The perspectives of and proposals from opioid use disorder prevention coalitions, recovery centers, medication-assisted treatment providers, and the ongoing challenges of the opioid crisis on marginalized populations, including individuals who have a lived experience of opioid use disorder. The committee has the assistance of the Department of Health, and annually the committee is to present its recommendations for expenditures from the special fund established pursuant to this chapter to the Department of Health, and concurrently submit its recommendations in writing to the appropriations committees and committees of jurisdiction. The meetings are to begin on on or before June 30th of this year. The committee shall at least meet at least quarterly, but not more than 6 times a calendar year. They are to adopt procedures to govern their proceedings and their organization, including voting procedures and how staggered terms should be apportioned. Meetings are consistent with Vermont's open meeting law. And for compensation and reimbursement, we have per diem compensation and reimbursement for not more than 6 meetings annually. And then we have language in 4773 that designates the Department of Health as the lead state agency to request and receive funding from the national settlement that is required by the settlements to have that designated agency. And then in section 4774, we're creating the special fund. And this is where the amendment is. That second sentence in subdivision A1 is replaced. So the language again would now read, the opioid abatement special fund shall consist of all abatement account fund monies dispersed by the National Settlement Fund Administrator to the department, the National Opioid Abatement Trust, the Supplemental Opioid Abatement Fund, or any other settlement funds that must be utilized exclusively for opioid prevention, intervention, treatment, recovery, and harm reduction.
Is that, Madam Chair, that's because of the new money that's coming in?
Yeah,
Perfect.
that language came from the AG's office, so it'll be consistent with what we're expecting to see.
Got it.
The only question I have looking at this is whether, so all the funds have to come to the department. So we just added on other, the trusts, the abatement fund.
Well, the question would be, are the guidelines going to be all the same? So in this case, in the first case, the funds that we're getting, the guidelines are very clear, and the advisory committee can't designate use, they can only give advice. So the question about the other monies that are coming in, are there other guidelines? I think, is that the question you're asking? It's not the
No,
question I'm asking.
I'm noticing that to the department only modifies the National Settlement Fund Administrator. And I was
Okay.
thinking that probably because we have a designated agency, all the funds are coming into the department.
Yes.
So I was thinking of just flipping the sentence to say, shall consist of all abatement account fund monies dispersed to the department by, and
Okay.
then have the list.
That's a good idea. That solves a lot of problems,
Okay, so let me, I saw
including the
this.
one I was,
And
Conjuring
yeah, and
up.
you're gonna ask for another change, so
okay,
I'll put both changes in one amendment.
perfect.
Okay. To the department. Okay. Okay, and then subdivision 2, the department is to include a spending plan informed by recommendations of the committee as part of its annual budget submission, and once approved, the department shall request to have the funds formally released from the National Abatement Accounts Fund. And then the department shall disperse monies according to the budget process. That's basically saying it goes through the budget process, and then you can request the money once it's approved. And then disbursements from the opioid special fund shall supplement, not supplant, or replace any existing future local, state, or federal government funding for infrastructure programs, supports, resources, including health insurance benefits, federal grant funding, and Medicaid and Medicare funds. And then at the top of page 8, we go into all the different uses for the money. So subsection B, if you think of it as, these are all the potential categories that we could spend this money on. And then subsection C says, these are the priorities for spending this money. So in subsection B, expenditures from the opioid abatement special fund shall be used for the following: opioid prevention, intervention, treatment, recovery, harm reduction, and evaluation activities, preventing overdose deaths and other harms, treatment of opioid use disorder, support for individuals in treatment and recovery and their families, connecting individuals who need help to the help needed, addressing the needs of criminal justice involved persons, addressing the needs of pregnant or parenting individuals and their families, including babies with neonatal abstinence syndrome, preventing overprescribing and ensuring appropriate prescribing and dispensing of opioids, preventing the misuse of opioids, educating law enforcement and other first responders regarding appropriate practices and precautions when dealing with fentanyl and other drugs, and providing wellness and support services for first responders and others who experience secondary trauma associated with opioid-related emergency events, supporting efforts to provide leadership, planning, coordination, facilitation, training, and technical assistance to abate the opioid epidemic, researching opioid abatement, implementing other evidence-based or evidence-informed programs or strategies that support prevention, harm reduction, treatment, or recovery of opioid use disorder, and any co-occurring substance use or mental health disorder. And lastly, the cost of administrative, technical, and legal assistance to the advisory council by the Department of Health. So that's sort of the universe of what the funds can be used for. And then in C, we look at the priorities.
I have some question about that. Is that all right? Is this list a list that comes with the settlement?
This list is taken almost word for word from the settlement. Subdivision 13 was added by the House, and the House did make sort of some changes so that the language was consistent in different places. But for the most part, the language was lifted right out of the settlement.
Okay, that's what I thought. And then number 12, implementing other evidence-based, that is fairly broad, so that there could be other things that we could do with the money, that's as long as it's evidence-based. Yeah, okay, that leaves a good door. All right, thanks, Kate.
Subsection C, priorities. So priority expenditures shall be aimed at reducing overdose deaths, including the following. So please let me know how detailed. Do you want to go through each of these? I know in the past you wanted to just do that sort of high level. Okay. So subdivision 1 is promoting the appropriate use of naloxone and other FDA-approved drugs to reverse opioid use disorders. Subdivision 2, increasing access to MAT and other opioid-related treatment. Subdivision 3, assisting pregnant and postpartum individuals.
I need to slow down, sorry.
Yeah.
I'm trying to read the ABs and Cs.
Okay. Would you like me to go through those?
If that's okay, do we have time or are we rushed?
Well, we could go through them briefly, but yeah, let's just go quickly through.
Okay, I'll start at 3.
Yeah.
So pregnant and postpartum individuals, enhancing services for expanding expert services to non-Medicaid eligible uninsured pregnant individuals, expanding comprehensive evidence-based and evidence-informed treatment and recovery services, including MAT for individuals with co-occurring opioid use disorder or other substance or mental health disorders for up to 12 months postpartum. And
don't worry, do whatever they want, I'll be right back.
Providing comprehensive wraparound services to pregnant and postpartum individuals with opioid use disorder, including housing, transportation, job placement, training, and childcare. Subdivision 4, expanding treatment for neonatal abstinence syndrome. Do I go back up high? Okay. Subdivision 5, expanding the availability of warm handoff programs and recovery services. Subdivision 6, treating incarcerated populations. Subdivision 7, supporting prevention programs. Subdivision 8, expanding syringe service programs, specifically providing comprehensive syringe service programs with more wraparound services, including linkages to opioid use disorder, treatment access to sterile syringes, and linkages to care and treatment of infectious diseases, and facilitating evidence-based or evidence-informed data collection and research, analyzing and evaluating the effectiveness of the abatement strategies. Then we have section 2, sunset on the advisory committee. So this asks for certification by the chair of the Opioid Settlement Advisory Committee to the governor, speaker, and pro tem. The Vermont share of the monies from the abatement accounts portion of the National Settlement Fund has been fully expended, the opioid settlement advisory committee is, shall cease to exist at that point. Section 3 says that the department can sort of pay in advance for the advisory committee working this next year and will be reimbursed once we draw down funds next year. And then the bill takes effect on passage.
Can you remind us what the total amount is in the initial?
Oh, gosh, I want to say
I
it
gotta
was
go back.
64.
Did she want me to?
She was looking for,
Oh, Anne.
okay.
I want to say it was 64. Please don't quote me on that. Is Nolan available to answer that question?
Nolan is here.
I don't want to put him on the spot. He might not know.
Nolan, can we
Sorry.
put you on the spot? Do you remember the total amount coming in for the initial abatement? The total abatement dollars, the first, no, okay, we'll go back. I'm sure we have that, but
Sorry.
just to get some clarity on approximate timeline. Okay,
Okay.
all right.
And, you know, so the amendment, it sounds like there's going to be more work needed on the amendment for those two items. And the language that the AG's office sent over only talked about in that one subdivision A1, expanding beyond the National Settlement Fund Administrator to other funds. And I'm wondering if the same change should be made in A2 and in section 2. So I am going to follow up with Josh Diamond to see if that was intentional.
Okay, yeah, that makes a lot of sense.
Okay.
Okay, that's good. And but then, you know, and after that, I think we'll feel comfortable with the bill.
Okay.
Okay. Good. Committee questions for Jen.
Katie.
Hi, Jen.
You can call me Hey You.
Oh my gosh. See, this is what happens. Any questions for Katie on this one? Okay, good. So we'll look at that when we get it,
Okay.
and then we'll be able to move. So we have H720,
Okay.
and there are some proposed amendments to H720. Where do you want us to start?
Let me just give you a high level reminder. 720 is our developmental disabilities bill. The amendment you have is a strike all, but there is only a one sentence change so far in it, but I know there is another piece of language that the committee wanted to discuss. So I will bring you to section 5 right now on page 7. This is the language on the housing and residential service pilot grants. And in subsection B, this is language that in fiscal year 500,000 is appropriated to Dale to develop housing and residential service pilot grants in at least 3 regions of the state.
Sorry, what, I'm sorry, what page are you
Page 7, section 5 of 720.
Okay,
It's
this
in
is the
highlight.
strike call amendment.
It's a strike all amendment.
Yeah.
Even though there's only one sentence change in here, I anticipated you might have more changes.
We're gonna
I
have.
don't s- You said it was highlighted?
Does
It's
this
highlighted on page
I must
7.
be on the wrong one.
Do you have as introduced?
720,
720.
Uh-huh.
Aaron
strike
posted-
all amendment. Full
Draft number 1.1.
Yep.
So Katie, does this include all the green and yellow that we have been?
Page 7.
That's different, Bill.
That's
You're
the,
thinking of a different bill.
I'm sorry, I'm so distracted.
Okay.
we're all distracted.
There's a lot
moving in the building right now.
We're gonna get through it. So let's go, we're on page 7, we're at the bottom, we have a little yellow sentence.
Okay, so new sentence. The department shall consult with the Vermont Housing and Conservation Board and other housing providers to prioritize successful housing projects for adults with developmental disabilities.
Good, this is good, we should put this in every bill we ever write.
Oh, goodness. Okay.
Yeah, perfect.
And then the piece that still needs conversation, let's see, if you scroll down to section 6.
Yeah.
This is the payment reform and conflict-free case management. And there had been discussion about seeking approval from the General Assembly for both pieces.
Do you have that amendment? I know it's a,
Is there?
what are the options that we
Sure.
have here? I know that at least for anything that is going to be an appropriation or revenue, related to revenue appropriation, is gonna need some kind of budgetary approval, but our goal here is to have this move through as quickly as possible.
Sure.
And so what are as you've been thinking about this, what do you think? What are your
Sure.
thoughts?
So you have a couple different options. You could have language that says that this requires authorization of the full body, meaning it has to go through the full process, either through the budget or as a standalone bill. If you don't want that,
Let's just say, I don't think the committee would be supportive of that.
okay. Other options would be to have a presentation at the beginning of the next legislative session, have a date certain, and require Dale to come in and describe its proposed changes to both payment reform and conflict-free management. You could have language about seeking input and feedback from the committee prior to it proceeding, something like that, but not tying it to any approval. Yeah.
We could do that. I mean, I'm speaking for myself now, but I think if we had that in place, that still gives and provides an opportunity for change.
So I'm looking at what you emailed us. Do you have?
This is different.
This is different? Oh, what, so,
It's a different, we're sort of landing on in a different option.
okay,
So what is being proposed is maybe we would add a subsection C, and it would apply to both payment reform and conflict-free case management. And it would say something along the lines of, on or before January, whatever, Dale is going to come into both committees of jurisdiction and give a presentation about their proposed plans and seek like input and feedback from the committees of jurisdiction before proceeding, something like that.
Do you think that's sufficient? I mean, because I think the advocates really want to have some kind of approval process, like Dale can't do this without us saying yes.
Well, we can have it go through the whole process, the whole budgetary
But
process.
that takes,
That would take the whole session.
yeah,
And so then how do we do that? We could say, we could add in approval of the committees of jurisdiction.
You could, if you wanted it to go through the whole process, you could say that they're coming in as part of their budget presentation and they're presenting the policy and appropriations related changes, and those changes have to be specifically authorized by the General Assembly, meaning it has to go through the legislative process and be adopted by the full
That
body.
takes it from January to May.
Yeah.
So nothing would happen, even if it were, well, I suppose we could act more
you
quickly.
could say something about the budget adjustment.
Well, yeah, that was a suggestion that could be made. We could have it be proposed during the budget adjustment process.
I haven't reached out on the payment reform piece, but I did ask Shayla yesterday about the federal requirements in terms of the timing with the conflict-free case management. And she was saying that it was around 2025 or 2026, but they would be sort of starting to implement earlier. It's not a switch that gets turned on and off. But that at least left me with the impression that if you were passing something in 2023, it would still give them time.
yeah.
But I don't have that same information with regard to the payment reform piece.
Well, the payment reform piece, that's state versus federal.
Yeah.
So maybe we split those two.
Okay.
And then,
Well, the payment reform does that require appropriations from us?
yeah,
Yeah.
that's the point. There's an appropriations piece associated with it, but the policy piece is here. We want to make sure that we're not sending the policy place away from the committees of jurisdiction.
Mhm.
So, which is what sometimes happens with
It seems to me if we have time next session, then
Let it go.
Then your first suggestion works, if that.
So it would require full General Assembly approval. So it would, I think, to be more specific, it would be the presentation and acceptance by committees of jurisdiction, with feedback. And then through the appropriations process, which would mean the full session.
Yeah, I think you could maybe say something like, if appropriations are necessary, then maybe that's self-evident, I don't know. Like, they can't spend money without us giving it to them, so, yeah.
Nolan is there. Nolan, did you want to help?
Yeah, I'm just listening and thinking. I
Okay.
think that you do have to give authority for expenditure authority, so they technically can't spend without approval.
Yeah.
Right.
But sometimes they approve and sometimes they spend and then ask for approval and budget adjustment. But
Exactly.
So the budget adjustment is a possibility. I'm also thinking it's the first year of a biennium.
Yeah.
So we may have reconstituted committees, and that might make a difference in the way this all happens.
But if there's not the rush, I mean, the
Right,
24,
it would give us a
25,
whole year
Yeah.
before. at least.
yeah, then it seems like it's okay to say that we need to
So
go
can
through
we
the
put-
process and I need to come report to this.
Yeah. I think I like the idea of having reports and presentations coming into the two committees of jurisdiction, House and Senate, Human Services, Health and Welfare. And then approval for any appropriations or payment through the budget process. Does that work?
Okay, so what I'm hearing is that next year, Dale will come into this committee and House Human Services, give a presentation on both payment reform and conflict-free case management. And seek the committee's feedback.
Yes.
Okay. Okay, and then you want to say that any required policy changes or appropriations to implement their proposed plans has to have specific authorization from the General Assembly? So that meaning it has to go through the regular process.
Well, any appropriation will have to do that.
It does.
And so with the policy. So I would want to say that how do we specify the committees of jurisdiction? Or do we need to do that?
To what end? I'm not
Well,
following.
the appropriations committee is going to be making decisions about appropriations. We are.
Yeah.
But we will be making decisions on policy. I think the way you said it's fine.
So you do want it to go through the full process?
I don't know how else to do it. How else do you get approval for an appropriation?
you don't. That's just a given.
Yeah,
You don't even have to put it in words. I think and that appropriations have to go through the legislative process regardless.
I'm not really concerned about the appropriation. I'm concerned about like the package of the policy
yes.
and the money, because sometimes just the appropriation is in the budget and the policy just sort of happens without language.
Yes.
So I guess what I'm thinking of is,
What about the policy can't take place until after the appropriations
Implementation.
have been approved by the legislature?
Yeah, but they're also going to want to be getting work done on it.
how about the policies, policy implemented upon approval, upon authorization from the General Assembly?
Yes.
Policy implemented.
Wasn't that what's already in the bill? I'm confused.
Well, I think there's a difference between seeking approval, which feels a little more vague, like what process, and then saying something about specific authorization. feels a little bit more like it's directing the legislative process.
Let's see what you come up with on that, because I think that sounds like the appropriate thing to do. We want to make sure it fits and the language is clear.
Okay. When do you want that presentation? You know, I always think of January 15th, but I'm thinking of a new
February
biennium.
1st.
Yeah.
Yeah, I think February, it's the first month of, it's
I
just
know.
like,
What,
this
Getting up
is
to
the
date.
secretary, this is the commissioner, you know?
Okay. I will put something together.
Oh, man.
okay, that's good. Is there anything else we need to look at in here?
Nothing that has been flagged for me. Those are the two pieces.
Okay, let's put a hold on that one then.
Okay.
We're getting close, it's feeling very good.
Okay.
And then we're moving along to, oh, this bill, this is the one that has the yellow and green.
Yeah.
So H 265, which is a child and youth and family advocate bill that we've been working on. Which draft are we on?
2.1.
Okay,
Just so you know what you're looking at, we looked at a draft, I think yesterday, with yellow highlighting.
Yeah.
I've kept the yellow highlighting because there are a lot of moving pieces, and I've added green light highlighting for additional changes, just so we can keep track of what's new and what we've already discussed.
good.
So, section 3202, this is sort of the mission statement of this group. Do you want me to go over the changes we already went over, or sort of?
No, I think let's try and get to the green.
The green, okay. So section 3203 is the duties and authority of the office. If you remember, the last time we looked at this, we split the list into shall and may, kind of following the healthcare advocates structure. And the version as passed the House said work in collaboration with relevant parties to strengthen the department services for children and youths. In striking departments, they're sort of broadening what the office is looking at.
I think you wanna strike the,
Word the.
I was gonna word that.
I want to strike
Yeah.
that too.
that was the one I found last night.
Oh,
Yeah.
goodness.
And I just wanna say, you know, while Katie's going through this, Katie and I went through that feedback we got
Right.
from Deputy Commissioner Erica Radke yesterday. So some of these changes are in response to her, and then Voice of Vermont Children sent out a very detailed response to her response. So we were trying to incorporate
And it's
some.
a process and you did a good job.
Yeah, that's what we're trying, that's what this is about,
Yeah.
thank you.
So
Okay.
no changes to subdivision 2, the newly renumbered subdivision 2. Subdivision 3, support children, youths, and families by providing information about service recipients' rights and responsibilities. It had been related to departmental services, and now it's just relating to service recipients, so it's not necessarily recipients receiving departmental services. No other changes in the shall section of the duties. And then in the may section, subsection B, there's a new subdivision 4 on page 5 that says, as part of the advocate's annual report that is under the shall section, the advocate may include findings and recommendations related to other services provided to children, youth, and families. The existing report is sort of focused on the department services. So the advocate could look at findings related to other services, not just the departments. Section 3204, subsection B, this talks about how the advocate is appointed. That the Oversight Commission shall recommend qualified applicants, and then the new language, subject to confirmation by the Senate, the governor shall appoint an advocate within 45 days from among the applicants recommended by the Oversight Committee. So this is sort of a two-piece change. The idea, when we get to the oversight section of the bill, it talks about how following a vacancy, the Oversight Committee has 45 days to make nominations to fill a vacancy. And then at that point, once they hand those names over to the governor has 45 days to make the appointment. And in that way, there isn't a vacancy that's sitting open for longer than 3 months.
Okay.
And then, let's see. Okay, I'm scrolling down to incidents and fatalities, section 3206, page 8. The two sections have been rewritten sort of to mirror each other a little bit more, and I know the department wasn't sure what was meant by a report necessarily of different incidents. So instead, this is asking the department, or it's requiring the department to notify the office of all incidents of actual physical injury to children or youths. And similarly, in subsection B, the department shall notify the office within 48 hours of a fatality or restraint and seclusion.
Okay.
Okay. Let's see, on page 10. Oh, okay. This language in subsection B on page 10 talks about that while carrying out its duties, the advocate or if the advocate or deputy advocate reasonably believes that the health, safety, or welfare of a child or youth is at imminent risk, the advocate or deputy advocate may disclose relevant documents or information. It had said to any individuals listed on an existing statute. I believe the department's concern was that they are not on that list because it's a list of who they can share documents for. So they might not be able to receive relevant documents that the advocate and deputy advocate could share with these other entities. So this is adding the department. They could share this with to the documents, they can disclose them to the department or any other relevant entities listed or both.
Good.
Let's see. And then that brings us to subsection C. This is sort of exceptions. This is saying that the advocate and deputy advocate can't publicly disclose certain types of information. So in subdivision 1, you can't individually disclose individually identifiable information about a child or youth, or the child's or youth's family, foster family, or kin in a kinship placement. So you can't disclose information about the family.
Okay.
And then 3210, this is really my change.
I don't know about this one. Go ahead, sorry. Nice to see something.
So I wanted to make sure, as in the second sentence of this lead-in language, that the advocates apostrophe modifies contractors.
Yes.
So that's why the comma is taken out and the or is added. And let's see. On page 13, this language is in the Oversight Committee's powers and duties. So right now, the commission is required to recommend qualified applicants for the position of child, youth, and family advocate to the governor for consideration within 45 days following a vacancy. So that's sort of the second piece of that 3-month window. And then on page 16, subdivisions H and I were added, just so we could get the kind of conjunction right there, striking out the and after H and adding it before I, or after I and before J. And I think that's it.
Okay, so all of this looks very good. And we have just received an email from Marshall Paul about the bill, and he does make about 3 or 4 different recommendations. One with respect to, and we don't, Aaron sent it to, it was sent to Aaron, and Aaron, I think maybe you should post it so everyone can see it.
I don't
And then
have
he
it.
forwarded it to he forwarded it to me and to Ruth and to Katie, because we've been working on this bill, but we should all, it just came in, so it's
My
not,
email doesn't seem to be working. I'm not getting.
it's from here. So, and he's gonna post it, you'll be in the, included in very soon, I just barely looked at it.
Well, no, I mean, I think there's something wrong with my email, because I'm not getting emails. The last email I got was from you at 6:40 a.m.
Huh.
So I'm not sure what's going on.
Sometimes if you, check your Wi-Fi, make sure you're on the right Wi-Fi,
Yeah, I just changed Wi-Fi.
and then,
I'm gonna actually shut down my computer
Yeah.
and then start.
so anyway, there are some comments that he's made that I think, Katie, your legal expertise would be helpful.
Okay,
One of them was about the
Best
meaning of
interest.
best interest in the legal sense, and what are the implications here in this bill, and then there are a couple others. So what I'm gonna suggest is that when we do take a break, that you take a look at that, and if there are some, if it's major, we'll have to.
Did you
think
just
about
send me an email? I got it on my phone.
Okay,
It's uploading right now.
have you got it up there?
It's uploading right now.
He's posting it right now, so we should have it, then we can maybe take a look. So, any concerns about the language as it's currently before us in this draft? And then we'll look at what, Marshall Paul has sent. Okay, so we'll do that. We then have, I think at 10:30, we've got folks coming in on 464. But I want to give Katie some time to look at, I want to give Katie some time on the little proposal of amendment right now.
okay,
And then look at Marshall Paul's memo to us, and we'll try it, what I'd like to do right now is go through that briefly. I don't know if you can do that right now, or do you want to hold off until we come back?
I have really not had a chance
Yeah,
to read it
I
yet,
know.
but
So-
I could walk through 464 before you hear witnesses, if that is
Do you
useful.
want to go through 464 right now? That will, do you?
Which one is that?
Reach up. It's Ann Cummings' bill. She's gonna do it.
Okay.
Do we have recommendations in there? We
You have an amendment,
Let's look at it.
so if you remember, when we were doing our budget work, there was a question about why the governor's budget, budgeted for $130,000 savings and reach up, and then we had to add it back in after this bill. So in the bill, as introduced, there was language removing the medical review. And that was where the savings came from. In the course of the House's work, they sort of expanded the scope of the underlying bill, and there were lots of changes made in that section, not just the removing the medical review. And then, sort of right before appropriations was set to vote out its amendment on this bill, the department came back asking for additional money, and that's sort of when this conversation was happening about the $130,000 in savings. It's all to say, because the language was embedded in the existing statute, and it wasn't a matter of just saying this section takes effect on the different date, it was decided it would just go out the door the way it was. So what this amendment does is sort of untangles that a little bit. So what's happening in this amendment is we're striking out the section 8 in the House version of the bill where this medical review lives. And I'm adding a new section 8 and section 8A in, and they take effect, they both amend the same section, but they take effect on different dates. So section 8 just removes the language around the medical review team as the bill is introduced, and that takes effect July 1, 2022, and that would allow the savings to start this year. And then section 8A has all the houses changes to this section. However, because the medical review language has already been struck as of July 1, 2022 this year, that language is removed. It doesn't show in 8A because it's already been struck. And 8A would take effect, I think it's January 1, 2024. So it takes effect at a later date. And then the second instance of amendment is hard to understand without looking at the underlying bill, but it's the effective date section. And it basically says this section, and it adds section 8, which is where we're getting the savings from, and section 11 take effect July 1, 2022. So those are sort of the moving pieces in that amendment.
Okay,
So that gives us $130,000. Well, gives the appropriations committee, so.
Yeah.
okay, this is good. I think this one looks, well, we're gonna hear a little testimony later on,
Okay.
so we won't act on it. And I think that Senator Cummings would probably like to be here when we vote for this one as well.
Okay.
Okay, yeah, we'll do that next. All right, so, Katie,
Yes.
is it posted now?
464.
Marshall, yes. Okay, just refreshed. Okay, so you can see his comments. So if the language change that's gone to best interests poses legal problems, then maybe we revert to the language that was in the underlying bill. That's the only one I really just started to look at. And then I'm going to leave this in Katie's hands a little bit because there's a legal discussion going on there. And then why don't we do this, Katie? Why don't we give you an opportunity to look at this one?
Okay.
And then any other time that you might need to we'll work on the little amendments that we now have. We're coming back together at 10:30, and before we take a break, we're going to look at the two bills that we have on the notice calendar and the calendar that have come back from the House. One is S-239, which is not your bill. And the other is S-72, which is Michelle Childs, and we've received an email from her. So you can stay here and work, or you can,
Okay.
yeah, you can stay wherever you are if you want.
Okay.
Okay, so committee, let's go to S-239 first, and Senator Hooker has taken some time to evaluate the differences between the bill that she. Do you want to stay at the desk?
No.
Okay.
Thank you.
All right.
Do you want to talk? Can I go, what are you doing?
We're gonna take a break in just a minute, so if you don't
Just
mind,
enumerating who's gonna
Senator.
Oh, yeah, that's fine.
Stay right here for now, and we're gonna
Okay.
take a break in just about
Okay.
5.
All right.
I know you wanna,
No, it's totally fine.
yeah, okay, good.
So this will be split on this
Good,
239.
and I also wanna do 72, so
Yeah.
go ahead,
So
Senator.
239, simply, we've convened a group of interested stakeholders with regard to Medicare supplemental insurance policies and an expanded enrollment period. And the House just enumerated who those stakeholders might be, including, and there are a number of people that they have put on the list. And the second instance of amendment simply adds a section, subsection 4, where, or under subsection B number 4, where the group will look at the cost of Medicare Part D premiums and Medicare Part D plans supplemental plans and Medicare Advantage plans and how they affect people to make sure that it's affordable for Vermont. So
Okay,
those are the two pieces of it.
So it doesn't really change.
It doesn't change
No,
what we've
you
done.
know, it's interesting, after we passed the bill out, and I realized that we hadn't included some of the folks in that, including, I think, the dialysis.
Right.
And so that was, I was a little concerned, so I'm actually glad to see it put back in,
Right.
listed.
That's good.
Okay.
So,
Yeah, so
um,
it doesn't do a lot of what we wish to do for the bill itself, but
Yeah.
yeah,
no, it's what we have and it just fleshes out.
so I think we should just vote on this and approve it. And so I'll let Senator Terenzini will just take a quick vote on,
And this is just concurring with the House
and
proposal.
we're gonna
amendment.
propose to the House further proposal amendment.
Oh, we're gonna propose something else?
No, we're concurring with the House
with their-
further proposal
With
amendment.
their
And
proposal.
Senator Hooker's gonna report it on the floor
Got it.
today. And then we'll just take a minute to look at S-72.
Just for clarification, at the top, doesn't have a, this bill doesn't have a draft number at the
No,
top.
it's just S-72, further
That's two
proposal.
thirty-nine.
S-239, yeah, further
So
proposal,
nothing to put on that line there besides a scribbled house amendment.
yeah, it's further proposal.
I think it's just House proposal. amendment.
House proposal.
Right, House further proposal of amendment. On
It doesn't say
S-239.
further, but whatever.
It's okay, that's fine.
All right, I'll call the vote. Terenzini, yes. Senator Hooker,
Yes.
Senator Hardy,
Yes.
Senator Lyons.
Yes, and you can get Senator Cummings later if you like. So now Michelle Childs just sent us an email and I asked Aaron to post S-72 that's come back to us from the House. Again, a House amendment to S-72, that is the right way to write it, not further proposal. Right now. So Michelle Child's email reads, I've attached the House proposal amendment. It simply corrects two typos and substitutes gender neutral language in a few places. Let me know if you have any questions. I don't have any questions. If she approves it, then we know it's fine. But then the language, Aaron, is that up yet?
Yes.
Okay, so the language that is in the proposal is now up on our webpage. It's on notice today,
What are we looking at? Sir?
S-72. If you just refresh,
All right, got it.
and, did I report this?
You recorded this.
Okay.
I think, I'm pretty sure, yeah.
I do, I remember that,
Yeah.
okay, thank you. So these are really technical corrections to the bill. And this, it's on notice today, so we can do it, undo it tomorrow.
this looks fine with me.
Everybody okay with it?
I mean, I'm assuming Michelle's okay with it. Like,
So let's vote, oh, there's, she's in the nick of time.
It wasn't, I'm assuming Michelle thought it was okay to make this change.
Yeah.
Yeah.
Yeah, that's, you know,
Yeah.
yeah. So Senator Cummings, we just voted to accept the House proposal, concur with the House proposal on S-239.
That's the same one finance did
Yeah,
yesterday.
Really
Yeah.
be yes.
so it's easy. And now we're looking at language that came to us on S-72, the kids compact. And Michelle Child sent,
The interstate compact? I
Yeah.
thought you couldn't touch a word.
they changed, I'll read you Michelle's email. And then you'll be up. Here's, this good morning from Michelle. I have attached the House proposal amendment. It simply corrects two typos and substitutes gender neutral language in a few places. And then if we have questions, and if you go to our webpage, Erin has posted what is on the calendar notice for today, for tomorrow, we'll have it on second reading. So it substitutes things like his or her and puts in lieu thereof the child's. So it's just gender neutral language. And then, corrections. Are you okay with that, Senator?
Yes.
Okay, so why don't we just vote on that one?
Terenzini, yes. Senator,
Yes.
Senator Cummings,
Yes.
Senator Harvey,
Yes.
Senator Lyon.
Yes.
5-0-0.
Perfect, that's good. So this will take care of those two. We're gonna continue to see bills coming back. Be nice if it were all this easy. So now what we're going to do until 10:30, let me just make sure what all we're gonna do. We're going to take a little break. At 10:30, we're coming back to look at H 464, the reach-up bill. Katie did go through that proposal amendment with us that we have on our webpage. So we'll take time to go through that bill, and then Katie will still be here. We can have her help us out with what's in the amendment, especially since Senator Cummings just came in. And then we'll look at whatever we have left that Katie can bring to us on the bills we went through this morning.